Is fluoridated water dangerous? I'm Dara Star Tucker. They can spin, they can twist, rewrite, and deny, but I'm fact-checking fiction, because the truth don't lie. Robert F. Kennedy Jr., the new Secretary of Health and Human Services, has made fighting water fluoridation one of his personal crusades. Before stepping into his powerful role, RFK Jr. was best known for questioning vaccine science, promoting anti-fluoride narratives, and challenging long-held public health guidelines. Now that he's in charge of federal health policy, his stance on fluoride deserves a deeper look. Kennedy has called fluoride industrial waste and linked it to everything from neurological damage in children to bone cancer. But public health experts, including the CDC and the WHO, still stand by fluoridation as a proven and safe intervention. In fact, the Centers for Disease Control lists water fluoridation as one of the top 10 public health achievements of the 20th century, reporting that it reduces tooth decay by about 25% in children and adults. Roughly 3 in 5 Americans drink fluoridated water from their local system. The idea behind it is simple. Add a small amount of fluoride to strengthen teeth, especially in communities where dental care is less accessible. It's a measure that helps the people who need it most: the poor, the uninsured, and the underserved. Still, there are studies that raise fair questions. As Vox reported, the U.S. National Toxicology Program recently stated with moderate confidence that excessive fluoridation exposure might have a slight effect on IQ in children. But there's one caveat here. They were studying the effects of water fluoridation at above 1.5 milligrams per liter. The effect that had on children's IQ was about 1 to 2 points. And that's not nothing, but that's a far cry from justifying a nationwide ban on fluoride additives when the CDC recommends water fluoridation at a level of 0.7 to 1.2 milligrams per liter, depending on climate. That's well below the danger zone. Now, there's a real concern for the 1.9 million people in the U.S. who live near water sources with naturally high fluoride levels. In that case, it's important to use a water filter. Now, other claims that RFK Jr. has made, like fluoride causing cancer, have been consistently debunked by researchers. Large-scale studies have found no connection between regulated fluoride use and cancer risk. As with any substance added to our food, water, or medicine, the question isn't just, is it safe? The better question is, how much is safe? Fluoride, like many substances, follows this basic principle. A little can help and a lot can hurt. Let's look at a few other examples. Iron helps us produce red blood cells and carry oxygen, but too much of it can damage your organs. Chlorine disinfects drinking water. Too much, and it can irritate your lungs and skin. Vitamin A helps vision and immunity, but too much of it causes liver problems and birth defects. Heck, water can save lives, but too much can kill. Fluoride is no different. The levels added to the U.S. water supply are tightly regulated and consistently monitored. It's not being poured in recklessly. It's being added in very small doses to serve a very specific public health need. So when people who are not health professionals cite studies from other countries where exposure is 20 or 30 times higher than U.S. levels and try to get us to blindly freak out about water fluoridation, maybe the best thing to do is to take a beat and ask a few important questions like, what happens when you remove fluoride from water? Well, let's take a look at Britain, a country where less than 10% of the population drinks fluoridated water. British dental health has become a subject of ridicule, particularly in American pop culture, often unfairly. But there is some truth behind the stereotype. Children in non-fluoridated areas of the UK have significantly higher rates of tooth decay and hospitalizations for dental issues, especially in low-income areas. Without fluoride in water, the burden falls on low-income families to figure out how to compensate for dental visits that they probably can't afford. And in a lot of cases, there's a lack of education about how to maintain healthy teeth and gums. And the fact of the matter is, when you're struggling to put food on the table, the non-essentials tend to fall by the wayside, understandably. Now think about what the reality is in many Black and brown neighborhoods. We already face higher rates of dental disease, fewer affordable healthcare options, and less access to preventative services. If fluoride gets removed and nothing replaces it, who suffers? We do. Our kids, our elders. So when RFK Jr. uses his position to call for an end to fluoridation, it's more than just rhetoric. These are decisions that could harm the very people that public health policy is supposed to protect. We should question what goes into our bodies. We should hold government and science accountable, but we also need to trust real evidence and recognize when fear is being weaponized. Fluoride is not a conspiracy to contaminate the world's water systems. It's not poison, it's a tool, one that helps protect people who don't always have the luxury of a private dentist. So let's be alert, not alarmed. Let's be curious and not cynical. And above all, let's remember when it comes to our health and our communities, we need no spin, no fluff, no political high, just facts, receipts, and a watchful eye. I'm Dara Star Tucker, and the truth don't lie. Oh, and neither do I.
If you'd like to see more breakdowns like this, you can support my work by joining my Patreon at the link in my bio or in the comments.